Greetings. My name is Robert Matthew, and 6 years ago my life changed for the worse, or so it seemed. This presentation is a brief look at the journey of a life with CRPS and how it can affect your life and even the life of those around you. Hopefully by the end of this you can shed some light on this invisible monster, knowing how those who are under its affliction live day to day. At the time I was in prime condition. In the prime of my health, I was in the gym 6 hours a day as I was a personal trainer. But one day I started to have knee pain. Stubborn, I chopped it up to just a sore muscle. But then after 3 days, I couldn't walk and found myself in the ER. Months started to pass by, and my leg was not seeming to heal, turning deep purple and swelling up. I feared I was going to lose my leg. In and out of the hospital, I finally was sent to Tampa General, where I remained for 2 weeks. And many tests and MRI scans later, I was presented with the diagnosis of CRPS. With this diagnosis came unanswered questions, for not much was even still known about this disease. With a new unknown obstacle in my way, I left the hospital in a wheelchair, still unable to use my leg fully. I became frustrated and depressed. Everything I was doing at the time was stolen from me, from this invisible monster. So I decided to do some digging and research of my own. What was this disease I was diagnosed with? How is my life going to change? With not much known about this disease, research was difficult, but I managed to find out some information about this so-called CRPS and how relentless it can be. As I researched this disease, I joined a support group for many people suffering like me. Through this group, I was able to learn more about this disease. The invisible monster. I learned that there wasn't just pain, there was hair and nail issues, bone mass reduction, hypersensitivity, and much more. It was all overwhelming at the time. I learned I wasn't alone in this fight though. There were others like me fighting through every day. Though it is a rare disease affecting fewer than 200,000 people in the US, and only 1 out of 4 of that 200,000 are men, I still had support. With the disease not always being visible, support from people not suffering was hard to come by. I had to learn to live my life with this pain, relentless, never-ending pain. Every day is a fight, a struggle to get through the easiest task. There's a battle on the inside of us who suffer. The CRPS monster wants to destroy our spirit, and it easily can if we let it, which is why we try to stay strong. We support each other. Every day I struggle to overcome the grip it has on me, pushing through each day not knowing what this beast had in store. Then I learned it can spread. When I injured my hand, the monster reared its nasty face, now leaving me with a leg and an arm I could hardly use. I had no plan of what to do. This is where things needed to change, and I knew that. As I spoke to my doctor, the only reply I could get is there is not much information or known about this disease. Awareness needed to be spread. Learning that November was CRPS Awareness Month, I try to educate those around me about the disease, along with the struggles that are accompanied by it. Let's first learn what CRPS is. CRPS, which is formerly known as RSD, is a progressive disease of the autonomic nervous system and the sympathetic nervous system. The pain is characterized as constant, extremely intense, and out of proportion of the original injury, usually affecting one of the 4 limbs. CRPS generally has 4 main symptoms, but there are a great many additional symptoms that can occur over the course of the disease. Though every patient won't have all the symptoms, and the symptoms may change over time due to the stages of the disease in the patient. They may change. The first of 4 main symptoms is consistent chronic burning pain. The pain is significantly greater than the original injury. The patient's skin may feel cold to the touch, but to the patient it feels burning, like they're literally on fire. Followed by this burning sensation is inflammation, which can affect the appearance of the skin, causing bruising, teeny red spots on the skin, and the skin can appear shiny or even a purplish look to it. Also can affect the skin's temperature around the affected area, which can lead to and cause extremely excessive sweating around and near the injury area. Spasms are another main symptom of CRPS. Spasms can occur in the blood vessels, which is vasoconstriction, and in the muscles, sometimes referred to as rolling spasms of the extremities. Blood vessel spasms in themselves are scary, as sometimes if the affected area is close enough to the blood vessels near the heart, causing the feeling of a heart attack. The fourth main symptom of CRPS is insomnia, an emotional disturbance. This includes but not limited to the change in the limbic symptom system, which is a short-term memory problems and concentration difficulties. This can also affect the sleep cycle of a patient, causing sleep disturbances, which can lead to increased confusion. Once diagnosed, there are 4 stages of the disease, but most will never advance to stage 4. Stage 1 is the acute stage and typically lasts 1 to 3 months from the onset. This stage is where you will start to feel increased pain in the affected limb or area. Also, the burning sensation starts in this stage as well. Stage 2 is defined as traumatic stage. This stage can last anywhere from 3 to 6 months post-onset of the injury. The pain is constant, as in stage 1. This is accompanied by throbbing, burning, aching, and crushing in nature, and can be exacerbated by any stimuli. And this stage is where the most patients are diagnosed. Stage 3 is the final stage I want to educate on, as a small number advances to stage 4. The atrophic stage is the third stage and can last an unlimited amount of time. At this point, the data shows after 3+ years, patient's pain level remains fairly constant through any other injury can exacerbate the pain. With this information, I hope new thoughts have penetrated your mind, thinking of those who suffer from an invisible monster. All we ask is you remember, don't forget our pain, and we fight through it every day. We need more support, so go out now, keep in mind you have learned, and remember to paint November orange in honor of CRPS.